Welcome to the League of Women Voters Candidate Forum for the Board of Directors for the Health District of Northern Larimer County. I'm Ruth Long, the moderator for tonight's forum. The League of Women Voters is a nonpartisan political organization that encourages informed and active participation in government. Nonpartisan means that the League does not support political parties or candidates. I'd like to ask the audience to please help yourself to information regarding the League on the tables at the rear of the room after the forum. Candidate materials will also be available there when the forum concludes, if the candidates have any. We appreciate your thoughtful questions for the candidates. Please use the cards passed to you as you entered to write out your questions, and these will be collected from you by the League volunteers, sorted for clarity, relevance, and to avoid duplication. In the interest of nonpartisanship, we ask that the audience refrain from verbal comments or applause during the forum. And now to our candidates. We have 3 candidates running for 2 open seats on the Board of Directors. They are Robert Calhoun, Deirdre Sullivan, and Faraz Naqvi. We will begin with introductions. Each candidate will have 1.5 minutes to introduce themselves and explain why they are running for the Board of Directors. Then we will go on to the questions. Answers will be limited to 1 minute, as will closing statements. All will be timed for fairness. So we'll start with the introductions on the left with Bob. Go ahead.
Thank you very much, Ruth. My name is Bob Calhoun, and I'd like to share some of my thoughts about why I've decided to run for the district Board of Directors. The Health District is a powerful asset in our community. Its mission and dedicated staff deserve our support and active involvement. Since its inception, the district has served as the community's eyes and ears and often heart in looking out for the health of its citizens. How can we not support such a vital organization? I don't naturally like getting in front of people and talking, but I made that decision to do this because I wanted to run for the board because of how important the role of the board is in our community. My career has focused on the needs of individuals and families in my counseling practice. And as a board member, I would now have the opportunity to serve in a new way, focusing on the broader health issues of the county. I believe in the mission of the district and its emphasis on looking out for the needs of all the people, going where the pain is, looking from the bottom up. I also am drawn to the challenge the district will face as it seeks creative solutions to meet health needs in this ever-changing world of healthcare delivery, emerging health issues, and shifting demographics.
Okay, thank you. Deirdre.
Thanks, Ruth, and I want to thank the League of Women Voters for hosting this evening and being constant promoters of civic engagement in our community. I'm running for the Health District Board for a couple of reasons. I bring a unique perspective as a parent of 3 young children who are in the Poudre School District and someone who's done a lot of work as both a parent as well as a community health professional in our community to look at a lot of the factors in our schools that I think are very relevant to the work of the Health District. Physical activity, nutrition, mental health, and looking at that from a primary prevention focus. I also am running because I believe I have my ear to the ground in our community. I have lived and worked in Fort Collins for more than 20 years. My career has spanned adolescent substance abuse prevention to geriatric social work and long-term care to chronic disease prevention, tobacco control policy, and most recently promoting health equity among our Hispanic, Latino, and low-income community members. So I think that's a really important role and function and perspective to bring to the board as we are at a crossroads for this incredible organization that's supported by tax funds and is in a unique place to continue their leadership in our community.
And Faraz?
Yes, I'm Faraz Naqvi, and also thank you, Ruth, and thank you to the League of Women Voters for hosting this. The reason I'm actually running for the board position is very personal, and the reason being is that I'm a native of Fort Collins, and my family has been here since the early 1960s, and so you can imagine what Fort Collins looked like in the 1960s versus what it looks like now. And we can sort of see the changes happening before our eyes. Now, one of the things, I'm also a physician, and so I really, down deep, the condition of patients and the condition of a community to be able to take care of patients is very fundamental to me. So really, the driving force for me is that I see our community changing. And we have one of the best communities and the best health systems in the world, but we have gaps. And that's exactly what the health district addresses. And when I look at myself and I say that, will I be an asset, will I contribute to that, I really believe I will. And so that's really the driving force for me to run for the board position. One of the things that is very important to me recently is elderly care, because I think that that's the area of medicine that I focus on. And that's one of the areas that I see forthcoming that is really close to my heart to be able to address. And I think that the health district is going to have a very big part in elderly care going forward. And so that is one of my primary focuses. And that's really what the motivating force for me is.
Thank you. Let's go ahead and start with the questions, and we'll start with Deirdre. If you are elected and have a successful term, what will have improved in health services for Northern Larimer County residents?
That's a great question. I think that the health district has done a phenomenal job in leading and spearheading mental health, behavioral health care in our community. And we all know that we're at a crossroads, and the process that they have recently undertaken and taken that leadership role to look at our gaps and our needs. I think after a successful term, we will have delivered on those assessments, and that we will, the state of mental health in our community and substance use will look very differently. I'd also would like to think at the end of a successful term that leadership that they've played in dental care and mental health and substance abuse prevention would extend to other chronic disease prevention. Our health system is changing. We've converted from Poudre Valley Hospital to UC Health, and I think that there's a need for the health district and other health partners to look at obesity and cardiovascular disease and make some dents in equity among residents in our community.
Very good. Faraz?
So mental health, mental health has a number of different aspects, and one of the biggest impacts that it has is on the overall health of a patient and really access to care. Having lived in a number of different places, you can see that mental health has really driven things like the rise in the homeless population, the rise in sometimes crime rates within a community. So addressing that proactively, giving services and offering services to those who are in need or who are starting to begin that cycle of where they will start to need mental health is absolutely critical. What I foresee is that, first of all, I think that the health district has done a fantastic job, but I also anticipate that the demands that are going to be forthcoming from mental health are going to increase substantially. So I think not only taking what has been done by the health district now, but really planning for this to be a larger and larger role in the community is one of the goals that I would have going in.
All right. Thank you. And Bob?
Let me just add that I am a psychologist. I didn't have a chance to say that in my opening statement. I've been in private practice in Fort Collins since 1979. And I've worked primarily with families and couples in my practice. You know, I believe that the health district has set focused on three primary goals for the years ahead. The first being increasing access to insurance, getting more and more people, more people as possible signing up for health insurance. The second goal set out for the board is continuing the dental care program. And the third is focusing on mental health and substance abuse treatment. And I would hope that after 4 years, we would also see programs expanded in the treatment of mental health care. Thank you.
Okay. The next question, and we'll start with Faraz for this. How should the health district help our community in the areas of disparity regarding dental services and mental health? You touched on that, but.
Well, you know, that actually speaks to the overall health system that's delivered into the city and the county, and that's that you have gaps. You know, that the provision of services is done terrifically, but then you have gaps. You have certain areas that are just not fulfilled. Now, the areas of dental health and mental health are two of the areas that quite clearly fall into those gaps. The area of dental health falls into the gap because, largely because of a payment scenario with private dentists and the inaccessibility that some patients have. Similarly, the mental health gap usually occurs where people fall from social strata or economic strata into a lower one. And so I think offering those services and trying to reverse some of those trends that we see driving people into those gaps is one of the critical things that we need to address.
Bob.
I think the Health District Connections Program is something to talk about here. You know, in my private practice, there are a lot of people that show up, and even though they have insurance, they have a high deductible, and they're reluctant to go and receive the counseling that they need. I think continuing to support the Connections Program and building a positive relationship with the private practitioner community to encourage private practitioners to sign up to help see some of the individuals who need to be seen on a sliding scale would be very important to help close that gap, just like in the dental program, where you get the cooperation of private dentists to offer their time and their services.
And Deirdre.
Thanks. I think I'm going to answer this in two parts. One area that I think the health district has done an outstanding job, that many of us who work in public and community health look to the health district to provide data. And I think expanding the data collection to really look at specific gaps, specific disparities. We have lacked local data, for example, for our growing Hispanic Latino population for many years. And I think until we have that data, we can't adequately plan programming. And so that would be one area that I think kind of beyond that. The second concept I want to address is there seems to be a trend in shifting towards intervention and treatment. And I'm seeing the need for social emotional development in children. You know, more physical education in our schools, or, you know, my school's parent-teacher organization just approved $2,000 to buy a mental health prevention curriculum. And I think that speaks to the need for systemic change that I think is worth talking about.
Mm-hmm. Great, thank you. And we'll start this one with Bob. What ideas do you have to ensure success of the upcoming ballot issue to provide needed detox and inpatient behavioral health services in Larimer County?
You're speaking of the ballot issue to collect funds to build the facility.
That's
yes.
right.
Yeah, and
That's
that will
right.
be on the November ballot. I would think that it would be in the district's best interest, led by the leadership of the board, to do whatever is possible to spread the word of the need that we have. I mean, we do not have a detox facility in Fort Collins. As you know, you have to go to Greeley. And oftentimes, there's not a bed at Mountain Crest for people that need immediate care. So I think it's the board's responsibility to take on the leadership to educate the community and the voters how critical it is that they vote for going forward with this community project for mental health beds and detox services.
Okay. Deirdre?
I would agree. I think because there has been a robust process to really analyze what the mental health needs are, what the detox needs, what the substance abuse treatment needs are, that it's a very viable option. I think there's a lot of education to be done with the community about the gaps. I think the first part of the process has been well done, well executed, and now comes the next phase, as you mentioned, Bob, in educating the community, and that is an appropriate role for the board. I would also just say that partnerships are incredibly important, and I know that Summit Stone has been at the table, Mountain Crest through the health system, and so I think that because of those partnerships, being involved in the assessment and the gaps analysis, that moving forth with something like this is prudent and an absolute role of the district.
Good. Faraz?
And I would agree. I think that, the need for Larimer County to have basically inpatient detox facilities is critical. And I mean, I can sort of speak with this personally, that when I was also working with patients who did have alcohol abuse, there were often times when placement of that patient would be delayed because we, like you were saying, Bob, we had to send them to Greeley. And what would end up happening is that whatever plan of treatment that patient was going to engage on ended up getting put on hold. And so, and you knew that was not good for the patient. It was really not good for the community nor the practitioners. It just really created this pretty significant log jam in the healthcare system. And so having an inpatient detox facility in Larimer County, I think it should be a high priority and should be something. I also, this is sort of something that always stuck in the back of my mind whenever we would send patients off to Greeley, was it always struck me as being kind of unfair that, what we were, these were Larimer County residents and we were sending them off to Weld County for their treatment. So that's another reason I would support that.
Okay. Larimer County and its cities are regularly ranked as the best places to live and be healthy. Do you believe those rankings, and how does that type of media impact the role and need for the health district? I think it's Bob's to start.
I guess one concern would be that a lot of people would move here, and that would stretch our resources even more. I think also it could lead to a bit of complacency on the mind of the community, and and not seeing the needs that we really have here. We have some very basic needs that have to be met, and we might live in a beautiful, comfortable city, but there are people hurting. There are people not getting the services they need. That would be my concern, that there would be this concept that we don't have a problem. We don't have needs that need to be met. And people may not vote for things because they don't think we need them. That would be some of my ideas.
Deirdre?
Absolutely. I helped start a program about 8 years ago called Vitasana, and it is a coalition united for health equity. And the premise of Vitasana is to shed a light on the disparities that exist in our community. We lose funding opportunities a lot to our partners to the south or other communities because people do see us as this bicycle-friendly, everyone's happy, you've got a basket with flowers in it and you're going to the farmer's market and life is great. But the communities in which I work and have a regular presence, our mobile home parks, our affordable housing communities, it doesn't look that way. When their physician says, hey, you gotta lose some weight, they say, I don't have the funds to buy fresh produce, or there is nowhere to walk. We have a group of women who live up at Poudre Valley Mobile Home Park who wanted to start a walking group. There's no infrastructure for walking. So it's a huge issue in our community, and it's actually one of the issues on which I'd like to shed light in my attempt to run and serve on the board.
Okay. Faraz?
Well, this is a topic that's near and dear to my heart because it does deal with our community. I've got to tell you just a quick anecdote. This was years ago. I was actually waiting for a plane in in an airport in Germany, and there was a magazine sitting on, and it basically it said ranking the 20-something places to be in the world. And I opened up the magazine, and number one was Fort Collins. And you know, and having grown up here, you know, in high school, we couldn't wait to leave Fort Collins. And I'm like, what has happened to my town? But the truth is that we are changing. Because you know, the cat is sort of out of the bag. This is a terrific place to live. And that's one of the reasons that's motivating me to say that we need to stay on top of these gaps that we're developing in healthcare and the increasing disparity, because the people who are moving here are from all walks of life. I mean, they're not from a single demographic group. And so I think that staying on top of that is really a critical feature of what the health district's duties are.
Very good. What is the most pressing health issue the health district needs to address in the next year or the next 5 years? And let's start with Deirdre.
The most pressing health issue, I think we might have just talked about it. I think that whether you're talking about mental health or access to care or cardiovascular disease, that health disparities, in my opinion, is probably the one most worth noting. We have a major issue here that we've all just discussed. So I would say within those subject areas of dental health, mental health, chronic disease prevention, that overarching umbrella of health equity is a primary need. 5 years, I think we're growing at a rate that's such that it's hard to say. I imagine that behavioral health will still be a critical issue that the health district will play a significant role in addressing. I think workforce shortage will be another area where we're looking at provider shortages, particularly bilingual providers, and that's going to become a focus as we look at access to care.
Very good. Faraz.
So yeah, in terms of 1 year out, it seems like the primary issues are going to really be mental health, substance abuse, which oftentimes go hand in hand. And once again, and I think it does deal with sort of the significant increase that we see in the population of Larimer County, that those are rising to sort of the 1 year sort of critical issues that need to be addressed. 5 years, and again, this is something that's near and dear to my heart, is elderly care. You know, what's interesting is a very good friend of ours is a real estate developer, and he actually told us something very interesting about Larimer County the other day. He said that the majority of people who are actually moving here are older people to be near to their kids. That is you know, topping out younger people who are looking for jobs, students, everybody else. And so I think that the needs of the elderly 5 years out are really going to rise to the top, and the numbers are clearly there to show that.
Okay. All right. And Bob.
I would agree that in the next year, the focus still needs to be on mental health and substance abuse. But also, I think it's so important to continue the initiative to help people sign up for health insurance. The program that the district runs to help people sort out the confusion of how do you sign up for insurance? Am I eligible for insurance? Am I eligible for Medicaid? All of those things are critical in the short run are things that would be helpful immediately to the community. And for example, if more people were signed up, they may get funds to cover some of their dental services that might free up some funds that could go toward mental health services. And I would agree also that the aging population 5 years down the road is going to continue to be an issue that we need to look at and make sure that there aren't gaps in care, because I am going to predict that there will be, and it would be good for the district to get a head start on evaluating what those gaps will be.
Okay. So this one we'll start with Faraz. The mission of the health district is to enhance the health of our community population health is complex. How would you make decisions about what types of programs, services, and policies would be most effective in enhancing the health of our community?
So I would answer that in two ways. One is clearly looking at where the need is. If there's something that's a glaring need that needs to be addressed, that's obviously something from a resource allocation standpoint, you want to allocate resources in terms of addressing that need. The second way I'd answer that question is really, using that old term, the biggest bang for the buck. And what that sort of entails is that how many people can you help? What programs in sort of what is in terms of investment, what is your greatest return going to be in terms of touching the most lives, affecting the most people? And so those are sort of the criteria that I would use, is that you certainly need to address things that are clearly obvious to you that need to be addressed, but also they need to be looked at for their biggest impact on the community and the most people you can serve within those limited resources.
Bob?
I would agree with that answer. And also, it's my understanding that coming on the board, we're not required to know everything about everything. And so it's my understanding that the staff of the health district does a tremendous job of gathering data. And you have the triennial health survey in the community. The next one is coming up this year. So there's a tremendous amount of information, and that's the staff's job to prepare that in a way so that the board can analyze those things you're talking about, analyze and give us all the information we need so that as a group of 5, we can put our heads together, look at the big picture, see how the pieces of the puzzle fit together, and make our recommendations, and then send it back to the staff to figure out how to put the pieces in play.
Okay, and Deirdre?
I would echo the sentiments. I think data collection, as I've stated before, is a huge priority, and really looking at robust methods for collecting that data. That's a huge driver. I think letting best practices and research drive our decisions is critical. There are mountains of research that inform strategies and interventions. And so I think that's really important. I think having our ears on the ground and talking to our partners. I have the opportunity to sit at work among cubicles with care coordinators who are helping homeless individuals, children in our foster care system. And the conversations that I hear every day that families are facing are, I think, can be part of that, and that's an important piece. And lastly, I think that collaboration is critical. We have a county health department, we have a health system, we have a new health system in town too, and I think that convening and talking about what each entity is going to take on is critical in that decision-making process.
Very good, thanks. We'll start with Bob. How should the district partner with other key community health organizations on chronic disease issues?
Well, I think that the existing relationships that we have with our partners are solid. The direct services that the district does provide to citizens in need are critical. I think it has to do with continuing to build positive relationships with those other facilities, those other partners, sharing information. I think the sharing information piece of it is critical. The health district is in a position to gather that information and help support our partners with information that will help them deliver services. And also make sure that we don't overlap services so we have duplication of expenses that is unnecessary.
Deirdre.
I am by nature a convener. I think I was born to bring people to a table to talk about issues and solve problems. And this question speaks really closely to me because I think this is a critical need if we're going to address chronic disease prevention. We have a health department, a wonderful health department, but it is often priorities are set by decision makers who have to also fund jails and roads and bridges and other county-related services. So the health district is uniquely positioned as a health expert in this community with a solid source of revenue from taxes that doesn't exist with, for example, community health improvement at the hospital or the county health department. And so I think about the need to bring people to the table and say, how are we going to address the fact that Colorado is the only state in the country that doesn't require PE for our kids? Or how are we going to talk about Larimer County being ranked 9th out of the 10 big counties when it comes to enrolling people on food stamps and SNAP? And I think that that's a really important role and one that the health district can and does well.
Good. Faraz.
So partnering to identify chronic diseases is, I think, definitely the way to go. And there's many things. And if you look at the sort of the tiers that you can actually make an impact, obviously there's like the university, or PVH, the university. I also think that with other large organizations, healthcare organizations such as Banner, such as Kaiser, who are coming in and will be benefiting from having a presence here in Northern Colorado, they also should be part of that chronic disease identification program for the community as well. I think that you can also go down into other layers. For example, I'm the medical director at Miramont, the fitness gyms. And that's why Bob told me he works out at the Fort Collins Club, and that's why I don't see you because I'm at the Miramont Club. But they run a health fair, for example. And those are type of things that you can actually go and identify people, get them hooked into the system when you have identified chronic diseases. But also you can extend that to churches, you can extend that to a number of different organizations that aren't necessarily healthcare organizations.
Thanks. What can you do personally to increase community awareness of the roles and functions of the health district? And we'll start with Deirdre.
I think this is part of why I'm running. I have to say that the majority of people my age and people I hang out on the soccer field with or at community meetings or Odyssey of the Mind parent meetings, when I talk about what is the health district or that I'm running for the board, say, what's the health district? And I'm very passionate about engaging people in our community around the issue of health and human services and prevention and upstream factors that are impacting education and health. And I think, I don't think anybody ever says when I grow up I want to be a politician or run for office. In fact, know that that's not the case. But I feel like that's one of the duties in running, is that you're an ambassador for an organization, and to make people aware of what the health district does, their critical role and function in the community, and how people can be involved. That's part of running, and it's part of serving.
Faraz.
Deirdre, being Odyssey of the Mind, now I know where I've run into you before. Right. Oh, congratulations. We didn't make it nearly that far. But in terms of the community's awareness of the health district, it seems to me that not very many people are aware of the health district. I mean, it seems like we have this massive asset in our community that not very many people know about. And in fact, the people who are aware of the health district are usually the people who do fall into those gaps. And so the communication to the rest of the community, I just mentioned sort of things like the health clubs in town, things like, churches and other community organizations. The more awareness our community has that they have this, first of all, they have need. That members of the community certainly have the need to be able to access the services of the health district. But secondly, that there's this tremendous organization within town. I think you'll get a lot more collaborative actions and willingness to participate.
And Bob.
What can I do personally? I've been in town since 1979, not quite as long as you. I didn't go to high school here like you did. But I think personally, I am running for the board because of the people that I know who have been on the board and worked for the board. And they're people I respect, and they're people I've known over the years who are in different professions or perhaps my profession. And because I respect them and what they do, when this idea came up to run, I said, I want to do that too. And I've been around town for a long time, and I think what I can do personally is I can let, first of all, by running, people know I'm running, and that raises their awareness of the board and the district. And also, I can be an ambassador out in the community in the many areas that I'm a part of.
Very good. We're going to switch topics a little bit here. And we'll start with Faraz. This is on immunizations. An article today in the Coloradoan noted that only 9% of Poudre School District students were exempted from vaccinations. Please share your thoughts and discuss what the role of the health district could be in this area.
Yeah, it's clearly one of the more controversial topics that's occurred recently. And, what I always resort to when you run into those type of controversial topics is to resort back to the science and really look at what the science is telling you and what our best level of clinical data really does indicate. And when you do look at that, you really come to the conclusion that that immunizations are in general safe and really beneficial, especially for children. And so one of the critical things I think that the health district could do is two things. One is provide education and communication from about vaccinations, why you should, and really address concerns that people have, which are legitimate concerns because they're hearing about these, but they need to be addressed. People need to be educated. The second thing is that immunizations are one of those big bang for the buck features that you actually get quite a bit from not that much investment by immunizations.
Okay, Bob.
I'm a strong supporter of immunization. And personally, I lost a healthy 10-month-old daughter before an immunization was not available and became available 2 or 3 years after her death. I'm a strong proponent that people understand, have information, knowledge about it, and know what their choices are. I know everybody has that choice, and in some cases they have the choice not to do that, but I think I would agree with you that the district can push for education, information for all parents of young children.
Deirdre.
I'm going to take a little different approach because I think this question is one when we talk about what is the health district's role. The health district can't be all things to everyone when it comes to health. And I think that the issue and area of immunization is one that the health department has succeeded in and has really taken a leadership role and sees as a role and function. And so for the health district, it goes back to that bringing people around the table comment of saying, okay, leaders at the health department, immunizations and education to parents and the community is really what you see as a strength. How can we support you in that? Because I don't think we can't tackle mental health and substance abuse and chronic disease prevention and dental care and then, and all these. So again, back to that point of we have this robust community of health service providers and organizations. And I think it's critical to say who has strengths in what area, who's going to lead, and how do we as partners support that. So, and I think immunizations are necessary and wonderful, and I have lots of soccer field conversations about them.
Okay, we'll go back to Bob again this time. What health services do you see not being met for the homeless that perhaps the health district could provide and ways to reach them?
I don't really have a lot of information about that. I would probably rely on the health district staff to provide the information that is out there. Obviously, there are lots of organizations reaching out to the homeless. I know in my faith community we have a big initiative, a big effort in reaching out to the homeless. So I think I would, at this point, I would say, let me see the data. What are the needs that have been identified, and see if they fit in ways that the health district can offer services or help connect the homeless to other services. So.
Very good. Deirdre.
I think a lot of the services currently provided by the health district are exactly where we see the needs in the homeless community. Mental health, substance abuse, detox, treatment, dental care is critical. And so to me, it's really an expansion of that ability to serve as our homeless population grows. How do we meet those needs? How do we expand? How do we bring in other providers to help with that? I also think addressing the basic needs. And while, again, that might not be the health district's appropriate leadership role, I think it's important to determine whose job is it to really talk about the relationship between health and affordable housing, or the relationship of health and community development. And why, who does our city call on when they want to say, how does our climate action plan influence health equity or not influence health equity? That's a possible role for a health district to play. So I think the expansion of mental health, substance abuse, dental care, and then access to primary care is also huge.
Faraz.
Yeah, so homelessness is really a cycle. And once you begin that downward cycle, it continues. And the points that Deirdre brought up are exactly right. That if you look at the root causes, there's sort of three different things. They are economic reasons of being homeless, but they're also mental illness and substance abuse. If you look, and what's interesting is that the cycle usually ends up involving all of those things as it progresses. So what I view in terms of the duties of the health district are health. And so the two things that sort of fall directly into that are substance abuse and mental health, which again, bolstering those to the greatest extent possible, trying to break that cycle which leads people into homelessness. And then sort of to echo what you were saying also, that you find the partners who are supporting you on the economic side of things and support them as much as you can. But I think that the health district's duties should be focused on the health problems that they can address.
Okay. Let's see, I think we start with Deirdre this time. How can you increase services or outreach that costs money when budgets are not increasing?
That's a great question, and I think I would respond first with partnership. We have an incredible network of organizations and agencies and health partners who are able to seek grant funding beyond what we get from our regular tax-supported budget. And I know the health district does a phenomenal job at pursuing grant funding beyond their budget from local taxes. I think we have to, I hate this term, so I can't believe I can't say it. And I don't want to say work smarter, but as I go back to that notion of prevention and upstream factors, we can bang our heads against the wall trying to find strollers for families and clothing for homeless individuals. But if we're not looking at those root causes and really addressing those social determinants of health that are related to education and poverty, and that sounds like a big thing to bite off, especially when you're talking about limited budgets, but I do think that there's a need to look upstream so that we can expand with limited funds.
Okay, and Faraz.
Yeah, part of my background is in the business world and looking at budgets and being asked to, let's do the impossible with nothing. And and that's oftentimes what is asked for. And I know that, you know, what the health district has faced is oftentimes that, is that they're asked an awful lot, and they don't really have very much to do it with. But they've managed to do it, and that's what the incredible part is. When you're looking at a budget, one of the things that you have to consider is, it goes back to sort of a question that was asked previously, is that what is the pressing need? What are the things that are critical for us to take care of now and to allocate resources to be able to take care of those things? The second one, you know, once you've addressed those, the second thing is, what are we going to get the biggest impact out of? And so when you are under budget constraints, and when you have increasing demands without increasing budgets to really support that, really it becomes a prioritization, that you look at all the different programs and you really are forced to make those tough prioritization decisions.
Bob?
I would agree that that's the primary work of the board, to have to make those tough decisions. Have to look at what programs do we cut back on, where do we shift our funds that we do have to support the critical need of the moment. That's the work of the board, to work together as a group of 5 with the support of the staff to make those tough decisions. I'd also just add that I think our partnering with other community resources is another way to stretch that budget. And again, as I said earlier, looking for some of the private practitioners, especially in the mental health side, that can step forward with a little encouragement to help spread out the work.
Okay. This one we'll start with Faraz. As a member of the board, what would you do to reduce health disparities caused by poverty, racial and ethnic bias, and other factors?
That's a great question, and I think that's that's actually what I see as one of the critical duties of the board, is to be able to look at those things where you have a lot of inequality in the way that services are delivered, and to say that, can we address those and help to fill the gaps? Now, in terms of a lot of the factors that you mentioned, things like racial disparities, a lot of those things I think end up going along socioeconomic lines, where what you end up doing is, by identifying different socioeconomic groups, you can actually proactively go within those groups and try to address the needs and try to actually create some more equality, or actually provide what are basic services that are needed for those groups that are disadvantaged. But I think if you look broadly, what you need to do is really start to focus in and say that we can actually identify specific targets that will hopefully raise more to the mean all those groups.
Mm-hmm. Okay. Bob?
This is where I go back to data in our triennial community health survey is very important. And crafting that, hopefully in a way to pick up some of those disparities based along those different socioeconomic, racial lines. So I would put a lot of emphasis on that, and then being able to craft some outreach programs based on what that data shows us about where those pockets are, what needs in these different communities are not being met, and if perhaps there's a way to tailor a program that would help equalize those, eliminate those disparities.
Mm-hmm. Okay. Deirdre?
Again, this topic is near and dear to me, and I think my number one response is that we have to break the silos. Our community is incredibly rich with organizations and entities. We have a world-class school district. We have a world-class health system. We have a world-class city, but we're all working in silos. I sit as a parent volunteer on the school district's accountability committee, and we talk about education gaps that are the same gaps that we're talking about in healthcare. It's probably the same families that our Vida Sana promotoras are working with whose kids aren't graduating from high school. And those are just two systems to illustrate kind of where those silos are. I think if we unite as entities and organizations and we look at workforce development and equity in that, if we look at leadership in this community, I mean, we don't have a great diverse representation of people making decisions at the table. So it's no surprise that we have issues of racism and inequity. And I think, that de-siloing, there's a great story out of Seattle. They recently made their public health improvement, not Seattle, Spokane. Their public health improvement strategy was to raise the graduation rate. And when I think about something like that in terms of de-siloing, that's where I think we need to head.
Okay, thank you. Faraz? Oh, I'm sorry, you already answered that question. Okay. No, you did fine. Okay, I think we start with Bob this time. What skills and perspectives would you bring to policy making as a board member?
I would bring my 40-plus years of experience being a mental health clinician, a licensed psychologist here in Colorado. That's thousands and thousands and thousands of hours of sitting and listening to people and trying to assess. Being trained in systems thinking, my job is to sit before a complex picture, whether it's an individual, couple, a family, a group, and try to understand how the pieces fit together and what changes can be made to make it a healthy system. I think that's what the board needs. One, I can offer that perspective in how we make decisions, talk about things, and come to conclusions. I also have my mental health background, since it's one of the key issues that this board is going to have to work on over the next 4 years. I believe I can offer a voice, a perspective, an insight that will help the other 4 members on the board. They will have their expertise. That will be my expertise. I think the board needs that expertise at this time particularly.
Okay, Deirdre?
I'm assuming that, I think the question was asked about internal policy making. And
Yes.
I think that I'm a big supporter of the style of governance, policy governance, where board members don't talk about what color they want to paint the walls at the health district, or I think that can lead to mind-numbing board meetings. And I appreciate that the health district operates under that model. I'm very familiar with it, and I think that my background has been in local policy work, and while that's a little bit different from internal policy governance from a board, as I said, I'm a collaborator and a convener, and I think a consensus builder. And so for those high-level board decisions and conversations, having the skills to articulate an idea, to bring the community voice into that decision, and to really honor that model of policy governance is something I would offer, and something that is needed for effective board functioning.
Okay. And for us?
Well, I'm hoping that my background would be beneficial to a board. With my background, I've founded a number of companies. I currently sit on a number of corporate boards, and I've worked with some boards in Fortune 500 companies as well. And and having been on a number of boards or worked with a number of boards, the one sort of key factor that you walk away from, and I oftentimes tell this to the boards that either I'm chairing or part of with some of on the corporate world, is that we have to work. If we don't work, the organization doesn't work. And so it's very critical that a board has that understanding that all members have to understand that we have a common goal. And within that common goal, we've all got to move in that direction. And we may have very differing opinions about that, but nevertheless, you have to work together. Because I really do believe that to be true, is that every time I'm on a board, I say that if we don't work, there's no way this organization is going to work.
Okay. All right. We'll start with Deirdre this time. Is that right? All right. Okay. Do you have an opinion regarding Colorado Care Amendment 69 that will be on the ballot in November? And if so, which position are you taking and why?
I have to admit that I don't know amendment numbers. Are you?
It's the Colorado Care Amendment that would be universal care, health care for Colorado.
Oh, I'm sorry.
That's okay.
I should know that. What is my opinion? I think that I think we have an opportunity to look at the Affordable Care Act and what impacts it has presently. I think that the universal care for Colorado, while noble and well-intended, I guess I would say that giving the Affordable Care Act some time to be implemented and to see what that looks like is probably where I would lean. But that position could be changed with a little more education.
Okay. Faraz.
Yeah, so I've actually had the real fortunate, sort of the fortunate background of being able to study universal health plans, and have worked or have looked at a number of universal health plans, mostly in other countries, mostly in Europe. And, the conclusion that you come to is that they have their benefits, they have their disadvantages, but by and large, the benefits tend to outweigh the disadvantages. That usually, if the system as a whole ends up being improved, even though there are some areas where the quality of care or the ability to deliver what you want to is hindered somewhat. So I am actually a proponent of some form of universal coverage at some level. That having been said, I know that it's a terribly controversial topic. And it's one that I think that we really need the majority of people to be able to say that we are behind it and we support it, to really enact it. And, in the meantime, I sort of agree with Deirdre that the current Affordable Care Act is something that hopefully can address those issues in the interim.
Okay. And Bob.
Well, I personally support that amendment, but that's my personal opinion. As a board member, and it's a grand experiment for the state to take something like that on, if it were to pass. If it were not to pass, there is still a lot of work to be done on how to make the insurance exchange work for the most people. The board, that's not necessarily the board's job to take a position. Well, it is. I mean, the board can take a position. I guess we can talk about that. That's right. That is the board's prerogative to look at that and make a decision as a board and make an opinion on it. I will just say, about half of my clients at the moment are oldsters, like me, over 65, and they're on Medicare. And Medicare is a type of single-payer system, and it works very well. And it's very efficient. And I appreciate how it works for those people who are 65 and over. So those are some of my thoughts about the question.
Thanks. Okay, this one is a little different topic, and we'll start with you, Faraz. What type of formal complaint process is available in the health district if people can't get issues resolved internally?
That's a very good question. I'm not sure I know the answer to that question, actually. But
maybe you can approach it what should be.
What should be, yeah. And so, the way that you solve problems is to get feedback on what exists within those problems. And so having a feedback system where we are given data that comes back that says there are issues, that the number of complaints is significant enough that it really does point to a problem. And again, I'm not sure, Ruth, if this refers to sort of internal functioning of the health district, or it refers to programs.
I think that would be the internal functioning.
Well, and so that, the way I would actually go back is look at my management experience, where I've been really almost functioning with an open door policy to say that people who are involved in the organization really almost have an obligation to communicate with you if they see significant problems. It's almost an obligation to dissent if you see something going wrong with an organization or you feel that something is wrong with an organization.
Okay, Bob.
I think I would simply support what you said, that the board create a relationship within the district of being open to feedback, building cooperation, building a climate where people feel like they can bring their concerns to the board in a timely manner so that things are open and problems can be dealt with directly. It's a little bit like doing marital therapy. You know, if you bury it and don't talk about it, it just gets bigger.
Okay, Deirdre.
I would echo a lot of these thoughts, and I have to admit that in my research, I did not read the formal grievance policy for health districts, so that's one area that I would need to learn about. And I echo these. I think there's a fine line, though, and I think that high-functioning boards figure out how to have that open relationship and good communication with the employees of the organization that they oversee. But at the end of the day, a board oversees and manages one person, and that's a slippery slope. And I think it's critical to figure out where that line is so that you don't have mutiny and you don't have a culture where the staff is going to the board, and because, as you said, we have to work well together, and that doesn't lend to that. So I think that's critical, and as I said, well-functioning boards have figured out where that line is, and I think the board has done a very good job historically at the health district. So I would say it's important to straddle both sides of that coin.
Okay. This is the last question that I have for you. And let's see, we'll start with Deirdre. In your opinion, is the current spending model for specific programs within the district acceptable, or would you advocate for an increase or decrease in funding for one or more of them?
I would like to see an expansion for data collection. As I've mentioned in previous comments, having good data to really identify populations who are experiencing health disparities, I think is a critical role and function of the health district as a leader in that. No one else in our community collects robust local health data like the health district does. And again, this goes to that, how do you do more with a limited budget? But I do think, and one of my, the motivators for me running for the board is when we look at chronic diseases that aren't behavioral health related, I would like to see more emphasis on coordination and collaboration around cardiovascular disease prevention, obesity prevention. We have had a well-funded obesity prevention program at the hospital, but we're changing focus to clinical integration strategies. And I think that lends to a conversation about what is the role of the health district in primary prevention of cardiovascular disease, which is the #1 leading cause of preventable death and disease in our community. So that would be my only priority changes, possibly.
Okay, thank you. Faraz?
Yeah, Ruth, you always take more money when you can get it. So I'm just joking. But one of the things you have to do is you have to look at sort of where that money is coming from. And so usually with budgeted money, what you're doing is you're drawing money away from something else. And so to understand where that flow occurs and what you may be taking funds away from, I think is a very critical thing. Because you don't want to just be accepting increased funds without knowing sort of what impact it has overall. But if there were specific programs with increased funding, once again, I'm going to go back to the point that I'm very sort of wed to, and that's really an emphasis on sort of the chronic care identification and its impact on the elderly and elderly care. My personal belief is that if we can start to identify and make an impact on a lot of those chronic diseases, a lot of the issues that come up later on in care of the elderly will be a lot easier to manage. And so I think that that if there were a diversion of resources or an allocation, that would be an area that I would really look to.
Okay, and Bob.
I'd agree with what the two of you have talked about. One possibility, and I mentioned this earlier, if more people are signed up with health care coverage, Medicaid, other programs, and they have dental coverage in those programs, it could free up some funds immediately in the short run that could be used for more data gathering, which I think is powerful, in the programs you're speaking about. So that's one idea, but generally speaking, when I look at the pie chart, the budget of the district, you know, I feel like those priorities are right where they should be.
Okay, very good. We're going to have concluding statements now, and we'll be in reverse order, so we'll start with Faraz.
Thanks a lot, Ruth. And again, thanks to the League of Women Voters for hosting this. You know, when I looked at this, I talked to a couple people who are on the board currently who were encouraging me to sort of look at potentially running for this. And when I did that, I actually looked back at myself and I said, would I have skills or experiences that would benefit the board? And that's really, to me, what ended up being the most important thing, because I think if I felt that I wasn't able to offer anything that would push the board forward and make it a better board, it wouldn't be worth the board's time, and it wouldn't be worth my time, quite frankly, at that point. But I think, you know, when I look at my skill set, having being a physician, I think being a physician is critical because it really gives you an insight into patient concerns. Having a business background and having to work with boards and larger corporations and other things like that. Having been part of the safety net, you know, working with the Family Medicine Center, Salud Clinic, with some of the psychiatrists in town, I thought I did have something to offer. And so that's really what's motivating me to say that I think I can offer something good to being on the board.
Okay. Deirdre.
It's funny, I went through a similar process. When I was encouraged by friends and colleagues in the public and community health sphere to run for the board, I did the same thing, to say, what do I have to offer? And at the end of the day, I feel like I offer a unique connection to the community. My professional career has given me the opportunity, my professional career and my personal life give me the opportunity to work within systems that I think have very interwoven connections and relationships with health. Our city, our county, our school district, our nonprofit community. And when I look over the course of my 20-plus year career, I really have addressed health from womb to tomb. From adolescent substance abuse prevention at a local nonprofit to tobacco control policy. I was part of the team that got the first smoking ordinance for Fort Collins back in the early 2000s. I've worked on integrating academic achievement and health in our schools. I helped write the board goal around physical activity, nutrition, and mental health that exists today. And I think that those are really incredible assets. But more than anything, it's that ear to the ground that I think I bring, connected to the people who are experiencing health disparities and having a lens for what I think is going to make an impact in improving their health.
Good. And Bob?
And I too would like to thank the League of Women Voters for putting on this forum, and for all of you who showed up tonight in support of the health district election, and all those who are watching on TV. You know, the real winner here is the community. We got 3 people here that have something to offer to the board. The winner is the community, the winner is the health district itself, and those who vote. I think what I bring to the board at this time, given the need of understanding and trying to prioritize mental health and substance abuse treatment, is my long history and skill and insight and perspective on the inside of mental health delivery and the issues faced by the community. Thank you very much.
And I'd like to thank you, candidates, for taking your time to help the voters learn more about your views. Thanks also to the members of the audience and to the League volunteers who helped to facilitate this evening. A special thanks to the City of Fort Collins, whose cooperation made this forum possible. If you wish to learn more about the candidates, their positions can be found on the League's election website at vote411.org. Please encourage your friends and neighbors to vote on Tuesday, May 3rd. Voting will take place at 2 polling places in Fort Collins, the Health District Main Office at 120 Bristlecone Drive, and Spirit of Joy Lutheran Church, which is at 4501 South LeMay Avenue, the corner of LeMay and Harmony. The polls will be open from 7 a.m. to 7 p.m. Information on obtaining absentee ballots is available on the Health District website, which is healthdistrict.org, or by calling the Health District office at 224-5209. Thanks to the candidates and to the members of the audience for your participation tonight. Good night.